Hi. Hi, Jamie. Thank you for joining me. Hi, Heather. Hi, Shannon. I have my glasses on tonight because today was my day off and I did not feel like putting my contacts in, so here we are. All right. Tonight, we are going to be talking about why remote medical coding is not for beginners. I'm going to put a little disclaimer first before we get into this episode. There are going to be some people that are going to be able to get into remote medical coding. This is not me saying that you can't get into remote medical coding as a brand new medical coder. Right now, still we're coming off these heels of the pandemic. It is still possible. However, what I am going to be talking about tonight is why this is not a good idea and why remote medical coding is not really for beginners. So just putting that out there. Another thing also, tomorrow is going to be a pre-filmed show. I will not be here for a live, but I will have a pre-filmed episode, and it will be advice to nurses that are transitioning over to medical coding. I've been getting a lot of emails from nurses lately, so tomorrow is dedicated to the nurses. Hi, Tangela. Hi, Rebecca. Thank you for the blue heart and the little car. That is so cute. All right, so, oh, we already have 11, so I think we can go ahead and get started. 12, oh yay, thank you guys so much for tuning in. All right, if you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Tonight, I am going to be talking about why remote medical coding is not for beginners. So, let us begin. All right, so remote medical coding. This is probably the thing that maybe drew you to medical coding to begin with. Somebody told you that, yes, you can do remote medical coding. This is something you can do from your house and you can take care of your family, or, you know, you can do whatever you want to. You can set your own hours, and it's just, there's so much freedom and you can travel around. These things are untrue. The thing about remote medical coding before the pandemic happened, with remote medical coding, you had to have 3 to 5 years of experience before you could even think about being a remote medical coder. And this is because when you work remotely, you have to be able to do independent work. You have to be able to solve problems on your own. And this is a different sort of problem solving. Documentation in the real world is completely different from documentation that comes out of those medical coding books. So everything that you're being tested on, everything you're going over in school, all of that is well written. It's got all of the information. There are no holes. There's nothing for you to query. There's nothing that's missing. But when you get into the real world, you will find that there are providers who are stubborn, do not want to do what you ask them to do, and they have a difficult time understanding why. They think that because they wrote it and they thought it, that we're supposed to be able to understand what they're saying. We are supposed to be able to understand what they're saying, but it has to be clear in the documentation. This has to be, without a shadow of a doubt, be able to stand up in court that this is what actually happened on this visit. So there are some things that the technically trained medical coder will be able to spot. Obviously, not all of the words that are in the doctor's documentation are going to be exactly in the book specifically. That's why we have to know what synonyms for these disease processes are. But all of that takes, okay, somebody being a veteran and working with you and training you. If you are on your own and you are starting out remotely, you've never looked at a real live true medical record before, as far as like in a coding sense, right? You may have looked at your own, but you may not know what an actually coding through an actual note is going to look like, because there's always been examples, right? And even if you went through PractiCode and you say, well, those are real life examples, it's not the same. Okay, it's different. So when you're working at home remotely, It's not going to be that you can just set your own hours and set your own time like some schools would try to sell you. These workplaces are a business, and they need you to be there during the time that they are there, because you are there for their convenience. You're not there for your convenience. This is not like when you get years in and you have experience and maybe you're doing some contract work and then you can set whatever hours you want to, because it's not so much like where you have to be at a certain place at a certain time. There are places out there like that. But in the beginning, when you are brand new, you have to take the time to actually go to a place where you are getting trained, where you have exposure to other medical coders, and you have exposure to the providers. This is the thing that scares me a lot about this next generation coming up in medical coding, is that they keep insisting that they want to work remotely. It's a family issue, it's a medical issue, it's a health issue, it's COVID, it's all this and all that. Okay, the thing about it is, I have been back at my facility since 5 months after the pandemic started, right? So August, I went back to the facility and I have been there ever since then. The facilities know how to take those precautions. I have a condition that with asthma, right? That puts me at a higher risk. It puts me in the higher risk category, right? But I know how to take care of myself. I know the safety precautions to take. Everybody in the hospital knows the safety precautions to take. So that's really not an excuse. If you say, well, you know, I have asthma, I have this and I have that. And while, yes, some people are really immunocompromised, they should be at home in a sterile environment. That's not true for everybody, okay? And if that is you, that you have to be in a sterile environment and this is like an alternative that you think maybe could work, just keep in mind that when you are working by yourself, it is not easy to be able to figure this stuff out. As much as I harp on you guys to study, to go over your guidelines, to read everything like you should, it's not going to make sense until you're in the real world and you actually start to have exposure to all of these different scenarios and the facilities with their different rules. So they are going to have their own rules as well. It's not just what's in the book. It's going to be what they say goes as well. So even if you have a medical background already, and I've been getting, like I said, I've been getting those emails from nurses that say, well, I've been a nurse, so I want to do this at home. I want to be able to work remotely. Not being in the facility and not being able to build those relationships with the providers is a problem, because they say, well, you know, the coders, they're going to do whatever I say. That's what a lot of these providers think. And that's not true. We have to work together as a team. It is difficult if you are away from them and you are trying to do this by email. That is really hard. And a provider has a choice of saying, okay, I don't have to listen to you. You're telling me something I don't like. Or maybe you're expressing it in a way that is not appealing to them to even want to work with you. Because sometimes people have a difficult time writing. And if you have a difficult time writing, that's another hurdle. Because that's going to be your sole form of communication. If you're brand new and you don't know what you're talking about, that's going to make it 10 times harder. And I tell you guys to not start at home, not insist on starting at home, because I want you guys to be successful. I don't want you to sit out there struggling, because yes, while there have been new people who started at the beginning of the pandemic and they were able to get that virtual training, working from home and things like that, and they had somebody that really helped them, that's a 1 in a million right there. Because a lot of times at these facilities, if you're not in front of them, they're not going to want to help you. And then if you're emailing them all day, keep in mind, those coders also have a quota they have to make. And if you're emailing the supervisor constantly, supervisor has a lot more things to do than answer your emails. So being in the facility, taking time to work with the veterans and picking their brain, asking them questions is really going to be able to help you. Spending time and getting to know the providers if you are embedded in a clinic, or even if the office for the coders is in the facility and maybe the clinic is at a different place and you can go over there, stick your head in and say hello. Believe it or not, providers do appreciate that. I had a PA who left and went to another practice, and she wrote me and she's like, Blue, I don't understand why these coders are not like you. Why are they not coming over and talking to me? And then she goes, you need to tell your audience on YouTube that they need to make sure that they talk to their providers. And I tell her, I do all the time. And I promise I will let them know. Because it is important. It's important. And no matter what you think you are, as far as like, oh, I'm shy, I can't do that, I didn't want to get into this for that. This is part of the deal. If they're not telling you at the school, it is because they're trying not to scare you off. I'm going to tell you what is a straight and honest truth. I'm also going to tell you what the schools are not going to tell you, which is do not start in the beginning as a remote medical coder. You need to be in the facility, and you need to want to develop those relationships with the providers, with the staff, so that you can better understand what's happening. Even for me, when I get stuck on a procedure or I get stuck on a condition, because sometimes they'll word it kind of funny. So I'll take the documentation straight over to them and say, can we talk about this? Because I'm kind of confused. And they're like, okay, Blue, what's up? So they'll explain it to me, because I'll say, okay, well, I understand this part, this part, this part, but I don't understand what this part means. And I've looked it up and I've tried to find it. And they go, oh, yeah, well, that means this. You can't do that if you're away and you're at home. Well, Blue, my kids, and I want to be with my kids. Okay, but when you're working at home, your production standards are going to be a lot higher than they would be if you were in the facility. Well, I have small children. Everybody that I worked with when I first got here had little kids. They made it work. It's not impossible to make it work when you have small children. Oh, well, should I wait for them to get older? No, because again, everybody made it work. We had some single mothers. They were able to make it work. So it's really, there's options out there, and there's no excuse really when you're looking at getting into this field. This field is like any other field where it has its pluses, it has its minuses, it has its quirks. This quirk, this remote coding that gets sold to medical coders that are trying to come in brand new, is one of those things. But they're not, the schools are not going to tell you that new coders need 3 to 5 years of experience. They're not going to tell you that until maybe you hear about it later on, because then they would be losing lots of money. And when they get $10, $15, $30,000 ahead, you think they're going to be saying that information? No. They're going to tell you everything that you need to know, everything that you want to hear. That's what they're going to tell you. So I'm just telling you guys the things that I want to help make you guys successful, which is go to the facility. Don't try to start out with a remote coding job, because you can't stop in the middle of working to tend to your children either. Because when you're trying to concentrate on what you're doing, you have production standards you got to meet. You got accuracy standards you got to meet. You can't start and stop every single time. Now, I have a lot of distractions during the day at my facility. I have my own office, but I do have a lot of distractions. I can't imagine trying to tend to something and then get back to this. I've been able to handle it at the facility, but that's with grown adults. So again, wanting to stay home and doing this at home, this is not a side hustle. If you ever hear somebody say, oh, it's a side hustle, it's not a side hustle. A side hustle does not require you to have continuing education units. It does not require you to study. It does not require you to do all the things that we have to do to make ourselves sharp. It is cheapening our field when people say that medical coding is a side hustle, because it is not. It is not something that you can do part-time. Oh, just to get kind of started because I'm scared. You need to jump right in. That's the worst thing that you can do, is have that timid feet and not really try to like really get in there. You have to get in there. And you know, you're going to fall, you're going to get a little bloody. That's okay. Because that's what we do. Figuratively. Okay, guys, don't panic. Figuratively, that's what's going to happen. You're going to fall, you're going to get right back up. You scrape your knees, you get right back up. You scrape your elbows, you get right back up. Because it's not about how many times you get knocked down, it's about how many times you get right back up. And there's going to be times when you're not going to know something's going to be confusing to you. Your coworkers may not want to help you, but you have to start problem solving and working it out and trying to get with these providers and try to understand what they're saying and go from there. If you don't start building those relationships and that skill right away, you're never going to do it. And it's going to be harder for you. The more you're into the field, it's going to get harder. So Let's see what are these comments. Hi, Monica. Hi, Agnes. Thank you for all the blue hearts. Hi, Mitney. Penna. Hi, Blue. Where can I purchase solution manual for Pearson's Comprehensive Medical Coding 2nd edition? Did you try Googling it? Hi, Yolanda. Hi, Andrade. Thank you. Kay, this is so true. I always wish I can walk down the hallway and talk to my providers. Yep. Agnes, working remotely is not for everyone, especially if you have small kids, because you need to focus on what you're doing. Yeah, so that's the thing that I just want to tell you guys, because so many people write me, oh, I want to do this remotely. I want to do this remotely. You know how much you're missing out on when you do this remotely? I mean, I've worked remotely twice. I worked for a level 1 trauma hospital, and I've worked doing like same-day surgery coding, and I worked remotely at the beginning of the pandemic. The second time when working during the pandemic, misery. It was misery, and I hated it. I hated it, hated it, hated it. And my providers hated it because I was away from them, and they were so used to the interaction, and they were so used to seeing me, you know, being out there and answering their questions, because being in the facility and being available to them doesn't just mean that you can go and ask them questions. It also means that they can come to you and ask you questions. And that's the difference right there. Because if you're not available, they're going to run roughshod and do whatever it is that they want to do. So if they're not accustomed to you, and if you're not making yourself available for them in person to be around them and say, hey, what's going on? Then they're going to do whatever it is they want to do, because they're going to be like, okay, well, they're not here to help me, so why should I care what they say anyway? So, but I want you guys to know that, you know, it's hard for me to hear when people say, well, I want to do this remotely right away. I'm like, you have no idea what you're missing out on. Remote is for when later on, when you have had years of experience in. When I worked for the level 1 trauma hospital, I had been a coder for about 6 years. I had been a coder about 6 years in, and it was nice. It was nice to have that change and that break from what I was doing in the clinic, and also being able to do same-day surgeries. And that was good for me. It was good for me. You know, it's a level 1 trauma hospital, so you know this is very complicated stuff. It spoke to my orthopedic side that I really like. So that was good. And it really did, it did develop me into a better coder, because I had exposure to different things. But again, working at home, I felt a little bit of the disconnect when there was that, okay, well, I have to query some of these providers. There was that pang of not knowing who these people were. And they were like, okay, and they're just very dry, and they, you know, no personality, no nothing, and they answered my query and they moved on. And so there was no sort of connection, you know. When you're in medical coding and you're starting off brand new, it's not about your needs as far as like, okay, how can I make this convenient for me? I want to work at home. I want to do work whenever I want to. I want to be able to travel. It's not about your convenience. It's about the convenience of the facility, the convenience of the provider, and this is all for the patient. If you are not engaged, if you are not in it to understand what's going on, the patient is going to be the one suffering because of inept coding. So again, it's not about you, it's about the patient, and then the provider, and then building your skill. Napier says, I hope I said that right. If I didn't, I'm sorry. It's hard to find work as a CPCA. Seems like everyone wants experience. Getting discouraged, but I'll keep trying. Okay. Once again, because this is a common theme. If you've watched any of the shows from this week, or I've talked about this, I'm going to go over it again. It's okay. But I'm saying this more and more each time, and I should probably do like a resume review thing again. Okay. The thing is, everybody is going to want experience because employers are inherently lazy. They are not going to want to train somebody who is green. A lot of these schools try to shove people out of the school as fast as they can. 4 weeks, 6 months. They're going to try to rush you out there because that's their job, is to get you certified. Well, we have a 100% pass rate. We have a 95% pass rate. I don't care when people don't understand what they're doing. You can pass a test. And people have said, well, Blue, I feel like I was trained to pass a test. You probably were, because that's their job. They need to check that box that you passed the test so they can have their statistics. They have your money and you have your certification. Now you're in the real world. Okay, now these employers have gotten smart, because if they try somebody new who does not have any experience, okay, well, they don't have any experience. So their resume probably doesn't look like they're talking like a coder. And that's a problem right there. I have seen, because I do resume reviews, and I have seen many resumes that will be very like, well, Blue, I don't have any experience. No, but you do have training. What were you trained in? Diagnosis coding and procedure coding. Okay. What diagnosis coding? ICD-9 or ICD-10? We haven't been in ICD-9 in quite some time, but believe it or not, there are still people that have only ICD-9 training, still trying to get work in ICD-10 times. Believe it or not, it does happen. Trust me. But the thing is, you have to be very clear and very specific. They don't know you from Adam or Eve. So if you tell them, I have training in diagnosis coding, congratulations. Which one? ICD-10-CM. Good. Okay, now I have procedure coding training. Okay, again, which one are you talking about? CPT or ICD-10-PCS? Or are you talking about both? Because if you were trained in both, and even if you have only an outpatient credential, that's still good anyway, because if you know, it doesn't mean that you can't be trained on the job either. Okay, so if you were trained in ICD-10-PCS and you're comfortable with it, by all means, go ahead and put that on your resume. CPT and HCPCS level 2. Were you trained in that? Do you know how to use that manual? Yes or no? Do you know medical terminology, anatomy, and pathophysiology? Yes. Yes, Blue, that's common sense. That's what all medical coders know. Wrong. If you don't have that on your resume, you're wrong. And if I don't see that on a resume and I'm looking to hire, next, because you're not detailed enough to say that you've been trained in medical terminology, anatomy, and pathophysiology. When you look at any of these job postings, they will be asking you, if you've had medical terminology, anatomy, and pathophysiology, candidate must be proficient in medical terminology, anatomy, and patho. Okay, and what about all these other things? What about your soft skills? Do you know Microsoft Office Outlook and Microsoft Office Suite, right? Outlook, Word, Excel, PowerPoint. Do you have that on your resume? No. Okay, well, that's another thing you got to put on there. What about your language? Can you speak more than one language? Are you bilingual? If you're bilingual, you need to put them both on there. That you speak, and you speak and write what languages. Even if you only speak English, believe it or not, you'll see on those job listings, candidate must be proficient in English, written and verbal. Okay, now you've got that on your resume. What does your previous jobs look like? Well, Blue, I only worked at the Dollar General. Okay, well, you worked at the Dollar General, so you have experience with dealing with conflict resolution with these customers, right? You did stocking, so that means that you know how to use an Excel spreadsheet. You know how to keep track of orders that come in and orders that go out. And you know, you have all of those organizational skills. That's meant to highlight something that a coder would be able to do. They have to be able to know numbers and letters, because that's what we do. And believe it or not, even though it's just the littlest thing, that is what you need to have on your resume. Now, I tell you guys, I do resume reviews. Do not pay somebody who is not a medical coder to do your resume. I have seen too many that have come back from so-called professional resume writers who charge 2 or 3 times what I charge to review a resume or to rewrite a resume. 2 or 3 times what they, I mean, like, really? And I'm just looking at what they, and I'm like, this is crap. If I'm being honest, it's crap. And it makes me feel so bad for the person, because like they expect a professional to be able to do this, because it's one thing to be a good writer. It's another thing to be a good resume writer. The construction is completely different between a story and between a resume. Okay, so you have to know that, number one. I tell you guys to write your own. I've given you guys resume tips. Some people still don't feel confident enough and say, hey, Blue, can you do this? My rates have gone up because They have to, guys. But it's still reasonable, and I will be leaving them in the description box below. So if you're interested, you can reach out to me on that. But you have to have a really good cover letter. You have to have a really good resume. Then you have to apply for places that even ask for experience. So if they're looking for an outpatient medical coder and you have an outpatient credential, apply. They say, well, we want 3 to 5 years of experience. Make sure that your resume looks good. Point out all the good things that you can do. Point out everything that you learned, and then still apply anyway. Because what's the worst thing that they can do? Reject your resume, okay? But at least they kind of have your name out there. And if you're doing that, then, you know, you're starting to make those connections. Apply for alternative positions to help you get that experience and get your foot in the door, because not everyone start off brand new right away as a medical coder in the facility. Medical records tech, even for release of information, for risk adjustment, for prior authorizations. Each one of these things is going to get you exposure, okay, except for the release of information, but it'll still kind of go hand in hand with the HIPAA thing and everything. We have to know HIPAA. And so that's going to get you in the door. So if you can start in one of those positions and then you can transition over, that will really help you. Last month, the month of October, was the month of the temporary agency. People ask me the same thing. Blue, I want to have a good job. I want to get a job. I don't want a temp job. If you're not working and you're a brand new medical coder, who better to advocate for you to get a job than the temp agency? The temporary agency is going to advocate for you to get a job because they want you working. They want you working because that means they're making money. And not only that, they have a certified medical coder on staff. So every single assignment that you get put on, whether it's one day or if it's 4 weeks, you still are learning and you're getting that exposure, you're getting that experience. Not only that, you are getting their training in their electronic medical record with whatever encoder software that they're using and all of these other things, and it's broken down by specialty and it's getting you more experience. So take the time to Google in your area temporary agencies for medical professionals or for medical professions, and you will see them pop up. I did this in the city of Dallas. I am not in Dallas, but I Googled for a major city and seen what they did. There was like 10 agencies that specified in medical professions, and some had specifically for medical coders. So that is what you need to do. Get yourself registered there. Get with them, and they're going to give you a test to make sure that you at least have the skill to be able to get in. So when you do that, then you can start making those waves, because that was how I got in. That was how I got in. I got in that way, and that was the only way that I was able to make it in. But people were telling me, well, we have rules about being able to hire brand new people. So that was what I was running into back at that time. So again, don't foo-foo working for a temp agency, because it's designed to help you. So that's what I would say to you. Make sure that you're not saying, oh, I'm a team player, because everybody's a team player. Oh, I'm on time. I work every day and I work really hard. They don't care. Everybody does the same. Everybody's the same way when they're trying to get a job. You need to show your skills, because again, they don't know you. You don't need to tell them about your private life. You don't need to tell them about your family situation or what's going on with your kids or why. They need to know about what skills you are bringing. Why do you want to do this? As far as how is what you're bringing going to better for them, better their situation? Because again, it's about the employer. All right. May need to start at an entry level and move to coding. Yes, trained to pass the test. Rita, we are looking for an orthopedic coder. Rochelle, good evening, Blue, and everyone in the chat. Thank you for all the blue hearts. Rita, are you looking for an experienced coder? Haiti, hi, thank you for joining me, BK. Hi, BK. The transition option sounds good. Juliet, hello, everyone. Rita says, have to have worked as an orthopedic coder or know that most that watch this channel are new coders, but believe me, employers are looking. Don't give up. Haiti says to Napier, I just secured a job as a medical coder for a pathologist and have a CPCA. Moral of the story, don't give up. There you go. Rita, don't give up. It has taken me years to get the job that I have. Haiti, that's wonderful and encouraging. Congratulations. So yes. And you know, it's important. Thank you for sharing that your company is looking for people, Rita. I appreciate that. Yes, I do have a lot of new people on my channel, but you know, Agnes, I started as an HIM associate, and when the opportunity came up, I applied and got the job as a coding reimbursement trainee. So there you go. Hello, Rao. So yes. That is an option. You just have to stick with it. You don't ever want to give up. You know, when I was out applying, it took me 2 months of being told to go pound sand until I went to the temp agency, and that was how I got started. I didn't want to go to the temp agency either because I thought that that was going to be a waste of time. I was resistant. But I had to think outside the box, and I had to, you know, say, okay, well, it's a job. At least it's some money coming in. And it was better than what I was doing, which was cleaning houses, being a bartender, working at these places where people think that they can speak to you any old way they want to, working at a halfway house. And so I was tired of it. You know, and when you're so tired of something, you'll do anything that you can to get out of it. You know. Hi, the next. Hi, Amanda. Oh, thank you so much, Rita. I appreciate that. She said you're great and encouraging. I appreciate that. But it's important that people know when you're out there and you're trying to look for these jobs, that not to get discouraged. Make sure that you're looking at what you're presenting. If you're presenting a really good resume, people are going to look at you more. If you're presenting a resume that's not so put together, then that's part of the problem. When I see resumes that come to me for review with ICD what? ICD-10 what? ICD-10 CM, PCS, you know, what are we looking at? And so I always tell people to be very specific on your resume. And don't put a lot of like filler words in there. You know, you got to make sure that you're getting to the point. Okay. That's what you want to do when you're presenting these resumes, because these resumes got to be a quick snapshot of what it is that you're bringing to them. What kind of skills are you bringing to this facility? Or are you trying to bring to this facility? Okay. Haiti, Blue, applying through an agency is so true. That's how I recently secured a job as a medical coder at a pathologist's office. And I'm a new coder. I'm so humble and grateful. There you go, people. There you go. Thank you for sharing your testimony. I appreciate that, because when I say things, I think people don't believe me, you know, and they're like, oh, this lady, she's just full of it. No, I'm trying to tell you guys, because, I mean, otherwise, how else are you going to be able to get in? You know, don't waste your time with dead-end positions like being a medical secretary, because if they like you as a medical secretary, that's where you're going to stay. Okay, you're not going anywhere. And if you're trying to do, oh, well, let me get into the call center for appointments and things like that, to be a call person for appointments, also a dead end. It has nothing to do with medical coding, and it will not help you in your quest to become a medical coder. You need to get into ground zero, where you need to make yourself available. Oh, so-and-so is a medical coder and they're over there in medical records. Let's go ahead and give them a try. This is a lot easier to transfer somebody who's already in-house versus somebody who's brand new off the street. Regina, congratulations, Blue, on obtaining your CCS. Oh, thank you. Welcome to the CCS club. I appreciate that. Thank you. But yes, it's nice. It's nice to have this credential. I'm very happy. I'm very, very happy to have it. It has been a long time coming. But again, before I started YouTube, I mean, I didn't really think about like what was the importance of it. What was the importance of having another credential other than the CCA? And that's where I started with the CCA. You know, Some people don't know that. That's where I started. And I had CCA since 2008, all the way up until March of this year when I passed my CCSP, the Certified Coding Specialist Physician-Based credential. And then 8 months later, I have my CCS. And this says that I have mastered both the inpatient and the outpatient side of coding, because that's what the CCS says, you know. D says, thank you for the advice, and you are welcome. BK, that's true. It's all about what you can do for the company. Not only do they look for the basics, they look for additional skills that will benefit the company. Yes, that is very true. And that's what I tell people, because that's what they're looking for. It is about the employer. It's not about you. And that, as horrible as that sounds, because we live in this time of, you know, everybody's feelings, there's part of it in business that is about the business. Okay. This is why schools get people all the time. They get people with a good mouthpiece who can sell the school. And it's all about selling the dream. They look for the best parts of it. And they look for the most fun parts of it. And if you actually look at what this is, it's not glamorous. You have to love it in order to really understand it, be into it, and be as nerdy as me. But that is what it is. It is all about however you want to spend your life. And if you want to spend your life constantly growing and learning and having to learn something new every single year, this is it, right? I can't think of a better profession. Although when you asked me when I was little, I was a kid, I wanted to be an attorney. Part of me still does. But that takes a huge backseat to what I do now, which is working in medical coding. I love being able to have contact with my providers. I love being able to talk to them and educate them. I love the challenge that they give me sometimes, even though sometimes it's just like, why are you making my eye twitch? Why are you doing this to me? I trained you better than this. But, you know, they come around, you know, and it's always like a huge victory when I can finally get one of them to be like, okay, fine, we'll do it your way. And then when they see that the detail is there, they see that I'm able to capture more specific codes and more specific procedures. And then they see everything get better and better and better. And they see that they far exceed their peers in other clinics, because my two clinics, ortho and podiatry, are the highest performing in the hospital. And when they see that, they're like, oh, well, you know, it's because we have a really good coder. You darn right. You darn right. And it takes effort. It takes persistence. It takes a lot of tears to be able to get there. I mean, as far as like, okay, I take it personally. I do. I shouldn't, but I do. I take my work very personally, and I want to do my best all the time. That's why I bring the best to them. I sharpen my own skills so I'm a better coder for them. I sharpen my skills so I'm a better coder for you all when I share this information, when I share anything that I know about the field, or when I share any coding tips. And when I look back on like the study hall videos I've done, again, low views on those. I'm going to make them into a playlist, so that way I can just leave the playlist there. So hopefully y'all will look at them eventually. But it is about these coding tips, and I put a lot of effort into those coding tip videos. And so it takes a lot, but I'm happy to do it, because to me it's touching the next generation of medical coders. And if people can be very detailed, it's going to be better in the long run. You know, people talk about, oh, AI and rah. You're not turning everybody into a robot. You're not going to do that. You still need the human touch. I'm just saying. Kung Fu Ken. It took me 1.5 years of looking for a coding job while working in a hospital, and that was honestly hostile, which later on let me go. My agency recruiter agreed that they were bad, and 3 months later, oh my goodness, Rita, tried to find a place to an internship to remove the A. The next, congratulations, but thank you. Ken, I found a coding job. Don't give up. D, yep, that's what happened to me. And BK, and it's true that companies rather transfer someone from another department than hiring someone new. And thank you, Haiti. BK, I was going to nursing school and wanted to get my foot in the door at a hospital. So I took a job as a psych tech in the psych unit. Agnes, yes, those uncertain diagnoses get me as well as incidental. BK, the HR director asked me, what other skills do you have? I told her my CNA license and I am going to nursing school. So when I graduate, I want to work here. I actually bypassed 3 other people. There you go. Napier, internships are hard to come by. I've tried that too, but I'm going to check the temp agencies too. Good. All of the advice is appreciated. I'm so glad. I'm so glad you're going to check with those temp agencies because it's very, very important. And any medical, like administrative position that they have other than being on the phone or being a secretary, go for it. Both feet. BK, she hired me because they used me in 3 other units. There you go. Again, it is about sharing your experience and what do you know? What's going to set you apart from these other employees that are applying? When I got my position here, I specifically put on my resume that I did inpatient professional services because that's what I did at the second position that I had as a medical coder. So I said that I specifically wrote that out and I talked about how many encounters I did, how I was able to bring the backlog down, how I was able to kind of revamp how the coding was done in that department, right? And that was during a short time. It didn't take long to figure it out after a while, right? And then working with the providers, that's what was really helpful. This was a teaching hospital. So, you know, being able to be hands-on with them was a regular thing, you know. But the attendings weren't really used to it. They were used to the residents getting all of it. But when they started to get it too, they were like, oh, okay, this is something different now. So I put that on my resume. And that was what set me apart from everybody else when I was interviewing here. And so when I interviewed here, they were very interested in what I knew about inpatient professional services, which is pro-fee, you know, pro-fee coding. And so I told them everything that I knew. They asked me what the differences between 1995 guidelines and 1997 E&M guidelines were. And I was able to answer that very fluently. And then I didn't hear back from them. And they had asked me, hey, you know, if you get a call, how soon could you start? I said 2 weeks to the day. Because when you're applying, there's no need to be coy. There's no need to be like, well, you know, I'm going to play with them and tell them that I've got all these other offers. Okay, if you got another offer next, you know, they're not going to sit here and wait for you. Okay, you have to be ready and enthusiastic and let's go. So when I didn't get a call and I didn't hear anything, oh, trust me, it was not pretty. I ugly cried because I wanted the job so bad. And my mom told me, don't you give up. Don't you give up. And so when I saw the job listing open up again, a short time later, a few weeks later, I applied again, but it was for a higher position. And my mom had told me, Blue, you're not getting it right now because right now is not your time. It's not your time yet. So I said, okay, Mom. And you always feel better when moms tell you it's going to be okay. And so then when I saw the second position open up, and it was for a higher position, I said, you know what? They rejected me for the first one. If they reject me again, it's okay, but they're going to see my face. That was a good interview. Darn it. You're not going to reject me and not say anything to me. So when I applied for it again, the job closed. A couple days later, got the offer. Didn't even have to interview again. I already got an offer. And it was for way more than I thought I was going to get walking in. And it was for a really good position. As I was like, well, hello. So that's what you have to do. Even if you get rejected from a position that you've been applying for, even as a brand new medical coder, you apply again. When you see that position open up again, you apply again. And keep in mind, guys, I was CCA. The CCA that everybody trash talks and says so much crap about, I was still able to secure a job with CCA. And a very good one at that. So, I mean, that's, again, I was CCA all the way up into this year, you know. Ilonda, congratulations on your success, Blue. Thank you. And thank you for sharing all of your knowledge with us. You're welcome. BK, it actually saved the hospital because I could work my regular job and they could use me in different departments if they were short too. So I got a lot of hospital experience, and there you go. There you go. It is about sharing what you know, sharing your skills. And again, if you ask me, Blue, why should I say I'm bilingual? If I speak all these languages, you know, I'm bilingual. Why do I need to put that on there? You never know who that facility is servicing, and what population are they servicing. So again, just being with an extra skill, you never know. That extra skill may be what sets you apart from the other candidates, you know. BK says that's why, like Blue said, it's all about what you can bring to the company that you're applying for. Be specific on your resume. Yes. Rita, good luck, everyone. I have to work in the morning. Congratulations, Blue, on your certification. Thank you so much, Rita. Thank you for tuning in. So sometimes it's not what you expect getting in, right? Because you have to go through all of this hoop jumping and all this stuff, and it really sucks. And I really wish that it would change. I really wish the culture of medical coding would change in this regard, as far as like giving people better chances in the beginning. But at the same time, I can kind of see, I can see both sides. I see the sides of the coders that have really worked hard, who really do grasp it and understand it, versus the coders that are just sort of there with the certification. They got into this because somebody told them about the money. They got into this because somebody told them about all these other grand things that they're after. And so they're not really wanting to put the effort in. They just want the job so they can get the money. And so I can understand the employer's hesitancy there, sometimes with these coders. But at the same time, when you're taking these pre-employment assessment tests and you're showing what you can do, I think that these employers should at least give you the chance, especially if you do really well. Because I did really well in a lot of those assessment tests in the beginning. And I was still bypassed because they had that stupid rule of, we don't hire brand new people. Okay, well, if you don't hire brand new people, you gave me an assessment test. I did really well on it. What is the problem? Well, Blue, can you come back when you get experience? Whatever. BK, I didn't realize that being bilingual is very beneficial. It came in handy a few times. And there you go. And so a lot of people don't give themselves enough credit. You know, and again, it's what can set you apart. It may not be required for that position, but you never know, you know. That's just what I say anyway. But yes, circling back to the beginning of why I had this very episode in the beginning to begin with, which was why remote coding is not for beginners, guys. It's so much better when you can spend time in the facility, get to know the environment, get to know the work. And I recommend this for anybody, for nurses that are getting into medical coding, for brand new medical coders who don't really know what they're doing just yet. I recommend it for everybody. Because even while nurses have been in the field and they've been bedside and they've done all these things, it does not guarantee that you're going to have an easy time learning medical coding. And there's a lot of nurses that are under that misconception. Oh, it's so easy. Oh, I do the coding all the time. No, you don't. What you're doing is you're selecting codes off of a pre-done list of codes. That's not coding. Coding is actually looking and reading and abstracting and getting diagnosis and reasoning out and querying when appropriate. That's what that is. That's what coding is. That is not just selecting pre-listed diagnosis codes and procedure codes and E&M levels. That is not that. So it's knowing the difference between the two. Having a nursing background is good because then you understand the disease process, but that doesn't necessarily translate to understanding how to diagnosis code, how to procedure code. It doesn't necessarily always translate to that. So that is something that I hope nurses don't take it wrong when I say that, but it's the truth, you know, and I'm not trying to challenge your intelligence, but what I am trying to say is medical coding is a completely different animal from being a nurse or being a x-ray tech or a surgical tech. It is a completely different animal altogether. Completely different. And that's why I say being in the facility and being around and making those connections in the hospital or in the facility, wherever you're applying and working, is really going to help you. So, you know, I just hope that it sinks in because, like I said, there's enough for you to learn, let alone trying to make it more difficult on yourself by being at home and being by yourself. Well, I don't like to work around a lot of people. I don't like to work around a lot of people either, believe it or not. You know, but in the instances when you're brand new in the beginning, it does help. It really does. BK says, that's true. You learn so much more in person. Not only that, you get experience working with others. That's right. Haiti says, that's true, Blue. I truly understand now why you say it's best for new coders to work in an office. You really do learn how to code in the real world. It's definitely not textbook. Yes, that's true. You know, when you look at what's in the textbook versus what is in the real world, sometimes I look at these obnos, I was like, man, I really wish my providers would document this way, but they don't. They're going to document however they feel that day. And some providers will document beautifully, like poetry. Gorgeous, gorgeous documentation. When I see it, I get so happy. It makes my heart sing. And then this same provider will betray that. And then they will be like, oh, you know, it's just very like, I'm like, what happened? Where's this beautiful documentation and now this, oh, well, you know, I was busy, Blue. Oh, okay, well, now you're missing a bunch of details here. And now I have to query you. Okay. So it just depends on their moods too. And so it's getting to know them and their moods and looking for all of these things. So BK says, plus working with other experienced coders, you can learn from them too. And that is very true, because it is about working with the other coders. And sometimes they will learn from you, even if you're a brand new medical coder. And sometimes they will teach you a thing or two. And see, that's the thing. That's what keeps us challenged, because if there's a new person, and this is something that maybe a lot of people don't know, when a new medical coder comes on board, oh, you better believe that all of a sudden, all these coders who have been, you know, a certain, you know, coding a certain way, they're going to up their game because there's somebody new coming in and they want to be the one that knows everything. So they're not going to have a new person show them up. So then all of a sudden, everybody's energy gets elevated into studying more, unless you already have that energy like I do, and you're already studying anyway. But you will see the competitiveness in the other coders come out when they know somebody new. So it's always good to have new people come in, you know, I think, because it keeps everybody on their toes and it keeps them moving forward. Because if you don't have somebody that's challenging the status quo, it's always going to be the status quo. And you never know, that status quo could be falling behind, because as things update every year and get better every year, it takes somebody who's paying attention to the latest and greatest that is going to bring that to that facility. A few years ago, we had a physician champion who came in. A physician champion, if you don't know, is a doctor who typically has a medical coding credential and can speak doctor to speak to the other doctors. Well, and this was at the transition of ICD-10 at the time, right? And so it was about a year after we had transitioned to ICD-10. And it was right around, it was about 6 months, I would say, 6 months after the implementation had come in. And so the dust had settled a little bit. We had already started doing our training with the providers beforehand, but this was coming in to kind of clean up some of that questions for some of those providers. So he came in. And of course, I'm suspicious, because I'm suspicious of anybody talking to my providers. I don't care who you are. I need to know what you're saying to them. So my boss said, okay, Blue, you go with ortho, and my partner was to go with the podiatry team. So I was like, okay, that's fine. Ortho was a lot more. There's a lot more of them. So I was like, okay. So I go in there and I'm sitting amongst the surgeons and the PAs, and I'm sitting there listening to this guy. And he's funny. He's a urologist. Funny guy, really smart. And so as he's sitting there going over this thing, I can see the surgeons in their faces like, huh? And then I'm asking questions too, because I say, can I ask a question? He's like, yeah. So I start asking him, I can't even remember anymore what it was. And he's like, you know what, that's a good question. He's like, well, and then so he explains it. Well, then all of a sudden you see the light bulbs going on to the surgeons and the PAs, and they're like, oh, now we get it. So we were able to sort all of that out, sort all of those questions out. And there was things that I didn't even know about that he had taught me, which was like about that follow-up. And he's like, well, you know, after this time, then you're going to do the follow-up code, and it's not going to be this. And I was like, whoa. I was like, I didn't know about that one. Well, at the time I did not know. It was all brand new, right? We're still trying to, you know, unwrap the plastic off of this new book and everything. It's figuratively, obviously. But he was like, well, yeah, you use this code, this code. I'm like, oh, that makes so much more sense. So, you know, I learned something from him, and I was like, wow. And I said, well, thank you so much, sir. This is so awesome, you know. And he's like, well, yeah, this is such a huge change for all of us. And I said, yeah. So, but it was during that meeting that, because I have my connections with my providers, that this physician champion had given us a packet. And to me, this was a very well-written packet. It had all of the bullet points. It had everything in there. And I was just like, yeah, this is perfect, right? So, of course, I have one of my surgeons who said, you see this, Blue? And I'm like, yeah, it's great. He's like, no, it isn't. He goes, I want everything on this down to one page. I was like, okay, you got it. He's like, really? So, yeah. I said, I'll get it back to you by the end of the week. He's like, okay. So I got it back to him, laminated and everything, on one sheet, all the bullet points. And he's like, I can even read it too. It was like, it was big enough for him to see. And so I said, anything else, sir? He goes, that's all. So, you know, it's just answering those little requests, but still being able to, okay, work with your providers. And trust me, when you're able to fly through their documentation, because it's so much easier rather than questioning everything and questioning yourself, you can see everything loud and clear. And it makes it so much easier. That's why I tell you guys, spend time in the facility. Don't try to be out remote right away. It's not worth it, guys, especially in the beginning. Just try to be there in the facility. If you're a shy person, you say, Blue, I'm a shy person. I can't do all that. I am shy too. Believe it or not, I am very shy. I am painfully shy. Trust me. This persona that you see here, I get excited because this is medical coding. But you get me out in the street, and I'm not talking about medical coding. I'm just there, a civilian in the world, and I'm very shy. People will talk to me, oh, hello, ma'am. Oh, hi. You know, I'm very shy, you know, but when it comes to what I do, oh, that's when I come alive. But it takes time. Again, this didn't happen until 6 years into my career, where I was like, oh, okay. Now I'm more confident. I got this. That's when that started to come into play. But it just takes time, and you can't count yourself out for how you think you are, because you can change. Everybody has the ability to be able to make themselves stronger and to be able to make themselves more professional, more polished, and everything else. So it is possible. You just have to put yourself in the position to be able to do it. If you never give yourself a chance, you're never going to get better. And that's why we have things like YouTube with their TED Talks and with all of these things that can teach you to be a better speaker, to teach you to be more assertive, to teach you to be more commanding when you're in a room of alpha personalities and you're trying to get your point across. Because trust me, when you deal with these alpha personalities, oh yeah, you've got to be alpha too. And that's why a lot of my attitude has changed, because there are some providers who will see me and immediately try to be like, no, I'm not doing whatever you say. And, you know, I've had coders before and they were horrible and you're just going to be just as horrible. Oh, no. We're not going to play this game. I was like, okay, I'm here to be your partner and your teammate. And that is what we're going to do. I said, because when you leave here and you go on to someplace else, you are going to be well-trained. You're going to be so well-trained that you're not going to have to worry about this stuff. But the time to learn and the time to ask questions is now. And I'm here to help you with any of those questions. And I keep what they ask me to between me and that provider. I'm not sitting here saying, oh, so-and-so doesn't know this and so-and-so doesn't know that. Everybody, the way that I talk about them to each other is so-and-so is good. And I truly do mean it, you know. And if I don't have anything nice to say, I don't say anything at all. So, you know, but that's what you have to do. And it's about putting yourself in those positions and not taking the easy way. Don't hit that easy button, because there's nothing good that's going to come out of that easy button. It doesn't make your life easier later on. It's just going to make things a lot more difficult for you. Elonda, Blue, have you ever encountered someone with a physical disability that was trained at a facility and transitioned to remote coding after a trial period? My facility, up until the pandemic, did not allow for remote coders. You know, but that is what they do now. They allow for remote coding. Some of the coders are on a hybrid schedule where they come in and then they, you know, they do remote coding and then they go into the facility. It really depends on wherever you're working. I have not personally experienced that, but I know that it is possible at some facilities, I have heard. But as far as me personally knowing somebody, no, I don't know anybody personally. But again, it really all depends on your employer. And like I said, there are some instances where it is true that the person does need to be at home. I mean, and I get that. But at the same time, you know, if they don't have something physically or they don't have a reason other than the fact that they are shy or they don't feel comfortable, you're not going to feel comfortable as a new kid on the block. You're not. Everybody knows that, you know, but for your kind of situation or for you saying something like that, no, I have not known anybody personally. But again, it really all depends on the place. So if you, you know, they have the Americans with Disabilities Act. There is that to protect people who have physical disabilities and who are able to work and who are able to have those reasonable accommodations made. If your facility says, okay, well, we have you, and then, you know, we can make reasonable accommodations, that is something completely for that person. So somehow I don't believe that, John. I don't believe you. John says I'm shy, to be honest. Somehow I don't believe you. But okay, if we're gonna say that you're shy, okay. But I don't think you are, sir. I'm just saying. And it could be the coffee talking, but I'm just saying. But going on. Katrina, hello, I'm a remote hospital care coordinator, and experience prior for doing coding remotely is a plus. Winky face. Yes, it is. It is. Because when you get out there in the real world and you're trying to do this and you're a brand new medical coder, oof, you're going to feel those moments where you're going to question yourself. So again, if you've had time in the facility, it's really going to help. And it's sometimes hard to put the question into words. And sometimes like being there with the person that really does help. And so what I used to do when I was at my second position and I was doing the profi coding, I didn't really sometimes know how to formulate the question. So I would tell my trainer, or she's my supervisor at the time, Jessica. Well, she's my friend now. We've been friends for years. And so I would tell her, Jessica, I don't know how to ask the question. I know I have a question. I don't know how to ask. And she goes, okay, what do you got? Tell me what you got. And so I said, okay, so the situation is this. I think it's this, but, and she goes, now I got you. So then she would start breaking it down. But she's saying, I get how you say that you don't know how to formulate it. She goes, because I wouldn't have known how to come up with a question like that either. So, and it's easier when you're in person, you know, and sometimes it's harder when you're on the phone or when you're in the chat box. And, you know, the internet, while it has helped us, it has also hurt us, I think, as far as like being able to communicate. And at the time, you know, this is before all of this Zoom and everything else. You know, that to me was a much better time when we were able to talk things out and be with people more, you know. BK says, I do want to eventually find a job as a remote coder, but because of my condition, besides my CIDP, I am also immunocompromised. But I know that being in a facility to get as much knowledge as possible is always a plus. And as long as you know that, that's okay. You know, as long as it's not that, oh, I immediately want to do this and it's all or nothing type deal. You know what I mean? Like, I don't want people to have that all or nothing type of plan when they are first getting into this. I want them to be able to be open enough. Please be open enough. That's why I'm doing this video, is to just tell y'all to be open enough to start at the facility and not be so insistent on working at home, you know. The Luxury says, just tuning in, any advice for anyone who is already in ancillary healthcare with EMT experience and medical terminology understanding? Ilanda said, thank you for your thoughts. You're welcome. And I can't, yes, I can imagine, BK, I can imagine. But the Luxury, are you talking about getting into medical coding, or are you talking about that you're already a medical coder and going into remote coding right away? Is that which one are you talking about? I'm kind of laughing at myself because I have my glasses on. It's been a while since I've done a show with my glasses, so I'm not used to I'm not used to seeing myself on camera with them. While I wait for the Luxury, does anybody else have any other questions? Yes, no? So, I know as soon as I start to answer the question. Okay. Tracy says, I'm a new coder and I wanted to work at any facility, but never could get an interview. I'm currently working remote. Oh, that's great. As a coder? I'm assuming. The Luxury says, I'm talking about getting into remote coding and just getting started into it. I mentioned in the beginning of the video that I'm going to do a video tomorrow for nurses and for people who have had experience in medical already that want to transition over to coding, if it would be something that they could do easily and that kind of thing. And the thing about having that experience, it's not the same as having coding experience. But working in healthcare, like in the bedside and things like that, and being EMT, that doesn't mean that the coding is going to be easy for you to understand right away and that it would be easy for you to do at home right away. I had a couple of nurses last couple of days that asked me, well, Blue, I'm a nurse and I want to do this remotely. Can I do this remotely? And I tell them the same thing that I would tell anybody, is that you need to work in the facility. You need to work with other coders before you start looking at working remotely. And it doesn't matter what experience you've had. Is it going to be easier for you to be able to read the documentation? Sure, because you're going to understand, you have really good medical terminology and anatomy and patho, and that's great. But it does not necessarily mean that you're going to understand what's happening with the coding. And for some people, there was a lady that had shared earlier that she has other coders that were nurses, and they were like, "This is hard. This is really hard." And I'm like, "Yeah, that's what I keep saying." And they were like, "Well, you know, we're nurses, and so we didn't think that it was going to be that hard for us." Nursing, the way that they think about coders is, oh, they just circle diagnoses on a sheet, and that's not what we do. We actually have to comprehend what's going on and abstract and really find out what's happening and code the levels appropriately, code the procedures appropriately, and be able to break everything down. So again, having that experience is going to be good for you to understand this stuff. But again, just to be out of the gate working remote, it still does not work. If you are brand new, you need to be at the facility. At least that's just my advice anyway. John, I like a strong woman in glasses. You rock them well. What did I tell you? You see, I told you you were not shy. You're so silly. Alonda, BK, thank you for your input. That does make me feel more motivated. I do have 20 years in the health profession as a certified medical assistant and a CNA, just switching to the business side. See, there you go. BK, that's so true. I agree that a remote coder should be for people that have had some experience already in medical coding, at least in person. If you have a question, at least there are others there to help. Remote coding, you're basically by yourself. Yes, and you have to be able to figure the stuff out on your own. You know, when I worked for Level 1 Trauma Hospital, let me share with y'all this. I worked for a Level 1 Trauma Hospital remotely, right? And so when I did this in the evenings. And so, of course, there's nobody there because everybody that is there, they're there during the day. Well, this was a position that I could work whatever hours I wanted to, just as long as I got my hours done. That was the whole point. You get your time done. We don't care what time you work. And I'm like, I could do this. So I would work in the evening time. That is when I'm fresh and I'm new and I'm more awake, more alive, because literally, truth be told, from 3 o'clock down, I am awake. Even though when I'm at work, I'm still alive and awake at work, but you notice that you have more energy at certain times of the day. And so I noticed that I have more alert energy in the evening hours. And so that's what I would do. And so there was nobody around to work with me. Now, there was a lady that lived in Alaska. So she would come on in the evening time. But for her, it would be the early afternoon time. So personally, I think she was just coming in to check on me. But she claimed that she was using that time to ask me questions, which was fine. I mean, I was willing to answer her questions. I didn't care. I was there. So, you know what I mean? And you can check the clock and you can see when I'm working, what I'm doing as I'm moving throughout the record. So that was just me personally. She's a sweet lady. I love her. But again, I think personally that's what she was doing. But everybody has their own management style. To me, if I'm a manager and I know that person, we're all adults. You need to work. You know what your job is. Get it done. I'm not going to sit here and hound you. I want you to work appropriately and I want you to work efficiently and I want you to work with the highest specificity that you can and accuracy, but I'm not going to sit here and harp on you because I know what it's like to have been micromanaged, and I cannot stand being micromanaged. I will not be micromanaged. I had gone from having a supervisor that micromanaged me to my supervisor now. And I told my supervisor when I got with her, I said, I know you may have heard a lot of things about me already. I said, but I'm going to tell you this. I will not be micromanaged. And then she goes, Blue, I wouldn't do that to you. And I go, no, I'm just letting you know now. I do not do well with micromanaging. I will do my job. If you let me work and you give me that freedom, I will get this and more done for you. But I cannot work if I'm being micromanaged. And she goes, okay, you got it. Sometimes we have to remind each other. But for the most part, I will not be micromanaged. I will not, because I'm an adult. I know what I'm doing. Leave me alone. Leave me alone. Give me my space where I can be the mad scientist and do my coding. And we're fine. When you start harping on me and you start micromanaging me, I get very stressed out. And I'm a very different Blue when I get very stressed out. It does not help me work better. It makes me mad. And so it's just like, let's not do that. Let's not do that to Blue. So when I have my freedom to be able to work like I want to, I'm good. And that was the great thing about working in the evening was everybody was gone. Everybody was gone. There was nobody in the queue. And there was no other coders there except for the one manager that was there from Alaska. But other than that, it was so nice and peaceful. And the thing about it was I got a lot of those heavy traumas that none of the other coders wanted because they skipped over them. And so I had a lot, a lot of really complicated ones. I would get car accidents. I would get hunting accidents. I would get all kinds. And it was some of the most complex coding I have ever done. And I told my supervisor later, I said, you know, Trish, I said, this is like the Marine Corps of medical coding. There's no, I'm not kidding. This is tough. This is learning so much. And she goes, I see that. She goes, okay, well, we're going to work with adjusting a little bit of time off of that because that was just too much. She goes, there's people that are skipping. I know they are. And I was like, well, I got it done anyway. So multiple procedures, multiple injuries and all. So she said, okay, but I'm okay to work like that. That was good for me. But at the same time, it's not good for everybody. You know, had somebody else with less experience been in there, they might have been overwhelmed and quit. Whereas I met the challenge because I had my peace and quiet and I didn't have somebody over me, breathing all over me and saying that they need this, they need that. I was able to do what I needed to do. So, did I miss something? What did I miss? That's true. I agree that for remote coders should be for people that have had some experience already in medical coding, at least in person, and you have a question, at least there are others there to help. Remote coding, you're basically by yourself. And he said he was shy. The luxury. Thanks for the advice. You're welcome. Haiti, Blue, thank you for everything you have done for us. You're a true inspiration. Thank you so much. Because of you, I was able to receive a honest review on the medical coding field, and I'm thankful for that. Oh, good. KK says, yes, that's how I feel. 8 hours daily alone, trying to figure this out, plus talking to myself a lot. BK, Alonda, that is awesome. I know that you can do it. Having a medical background and medical knowledge is always beneficial. And like Blue said, it's all about lifelong learning and more information to learn. It may be hard at first, but hang in there and you will persevere. There you go. Learning anything new at first can be hard, but once you get the experience, it will hopefully get easier. It will, over time, it will start to get easier. At some point, you may be like, but then you start learning where you really need to buckle down and start paying more attention, you know, to certain things. So I used to be really scared of Mohs procedures. And if you've spent time in the CPT book, you know what I mean when I talk about those Mohs procedures. I used to be really scared of them until I actually sat down one day and I said, you know what, I'm going to understand this. So I went to that section in the CPT book and I started reviewing the codes. And then I went over them, right, in exercise. And I'm like, okay, now I get it. Because before I was so intimidated by Mohs, I was like, no, we're not. No, I'm running away because it was so complex. But then again, when you're having to teach yourself, you start learning the tricks of how to do it. So what I did was look at the answers and then reverse on how they were talking about the answer. And then that was how I was able to learn that. So when you're working remotely, that's a lot of what you have to do is Google some of these things that you maybe are not familiar with. Excuse me. And then you can be like, okay, well, that would make sense. And if I Google the answer and I look it up in the book just to verify, make sure, because you never trust the answer off of Google. You got to make sure that you check the code so that it makes sense. And then if you have those books, the Coding Companion or the Coder Desk Reference, that will really help you as well. So having those other tools is also what's going to help you. And especially if you're trying to do this remote, you know, you need to have all those tools, whether you are in the facility or you are remote. It will help you to have like the Coding Companion and the Coder Desk Reference for procedures or the Coder Desk Reference for diagnoses, which is on sale right now. I'm just saying on Optum 360, not an ad for Optum 360 coding, but it's there and it's on sale. John, do medical transcribers transition well into medical coding? It's interesting that you asked that because there is an inpatient coder who recently got her RHIT, and she used to be the head of the medical transcription. So she's transitioned over to inpatient medical records. So now she does the inpatient coding. She works with ICD-10 PCS all day long. So, but she's doing great and she's transitioned well. She really likes being a coder. So, and she was a transcriptionist when I first got here. So she had been a transcriptionist for years and she really likes medical coding. So she's starting her journey out on the inpatient side. So yes, it is possible. BK, I had bosses that were micromanager. I wanted to just to give her something to yell at me about. Katrina says, thank you for all that you do for patients. I worked closely with our hospital coders to get my patients' hospital stay covered and correctly coded to get all the appropriate levels of care. See, there you go. BK, I was learning phlebotomy. The trainer was over me, yelling and screaming at me when I was trying to draw blood from the patient. Was she trying to get you to blow a vein? I mean, really? Come on, you know. Ilanda, yes, you are so. Yes, BK, you are so right. Good luck to you as well. And we all can do it, guys. That's true. That is true. You know, and there's some micromanagers who foolishly think that, oh, if I yell at the people, it's going to make them, it's going to motivate them. And the micromanager that I came from before my current supervisor, the girls were asking about bonuses. They were asking about bonuses, and there was a budgetary issue or whatever. And the micromanager said, "Oh, well, you have a job. That's your bonus." But if it was you, oh, I'm sure that you would want a bonus, right? You would advocate for yourself, right? To have a bonus. So is that okay for everybody else? Please, lady, please, you know? But yeah, that was her attitude. And sometimes they think that that's the way that they need to be. And she would tell people, well, I need to be mean so that people will pay attention to me. No, people will pay attention to you when you know how to do your job appropriately a lot better. You know, if you are just saying, well, I'm the boss and it's what I say goes, you're in the wrong. Everybody knows that nobody listens to those types of leaders. You're going to do whatever you want to anyway. And so that's the thing, you know, with these leaders, and some leaders need to have a refresher in leading, because just because you're in that position doesn't mean that you know how to do that position. You just happen to be put there for whatever reason, you know. And for me, when I see micromanagers that you know, it's their way or no way, you know, I mean, you can do so much more with your position if you would learn how to properly do your position. That's why I tell people all the time, you don't have to be in a leadership position to build leadership skills. You don't. I'm just saying. BK, I told her to back off because you're making me nervous. So I requested a new trainer. It's hard to work with those types of managers. I agree with you. If they just let people do their job, we would get a lot more accomplished. And see, that's the thing. You know, and I had gone from having 2 really good bosses before this micromanager. So it was a foreign thing to me to have this horrible person over me all the time, constantly with the barrage of emails, needing this, needing that. And I'm like, you're just micromanaging to the nth degree. Really? Is that necessary? Oh, no, listen, that's not what I'm doing. I'm like, okay, whatever. Honestly, like, really? But that's, you know, for another time, another story, another time. But yes, so hopefully I have answered all of your questions when it comes to why you should not start off as a remote medical coder. This is more of a plea, really, than a request. Because when you start off remotely, it's going to be a lot harder than it needs to be. Versus if you're in person, you know, it's a lot easier in person. And up before I had my physician coding at home for the level 1 trauma hospital, you know, I had thought about that because I had never been exposed to my providers. My providers were always housed away from us because there was no room. We had an older hospital that had been built like in the 50s. And so that hospital was is now used as another just office building, but we had a brand new hospital built from the ground up. And during the planning time, they said, okay, we are going to make sure that the coders have offices embedded in the clinics because we want those coders to be on hand so they could build those good relationships with providers. And so, but up until that point, we had all been housed in a separate building, and it was 20 of us in this little tiny room in bullpens. And so that time would have been, you know, more beneficial to have people coding remotely because it was so many of us in that room. It was really hard to concentrate, but that's why you have headphones. And that's what I did. I had headphones the whole time. And the reason that I had those headphones was because otherwise they'll sit there and they'll try to talk to you. And like, I was trying to get my work done. But, you know, Tracy says, yep. But that's, you know, I don't know. But to me, I when the pandemic kicked off and I was at home 5 miserable months, I was like, oh no. No, 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 no. We're not doing this. And I was getting emails all the time. Blue, when are you coming back? When are you coming back? We're all here. When are you coming back? When are you coming back? I'm like, I'll be there. Because I literally couldn't take it anymore. I was just like, no. And it's so difficult because when you see their response time on emails, you know, get less and less. And it's just like, guys, come on. I need y'all to respond to me on email because I'm not there to chase y'all down the hall. So they laugh and they're like, okay, Blue. And so they would respond on email, but it's not the same. And you could feel the energy change. And so it's just like, no, I need to get back over there. So I did. And I've been there ever since. So, like I said, some of the other coders, they're working at home. And then they work 1 week out of the month at the facility. I do not do that. I am at 100% of the time at the facility. And I will not fill out the paperwork to be at home. Because I do not want to be at home. I want to be right there in my office with my providers in the clinic. You know, but that's just me. But anyway, so yes, but that's going to do it for me tonight, guys. And like I said, tomorrow is going to be advice for nurses, LVNs, LPNs, anybody that is transitioning from the medical field side and getting into medical coding. You know, just tips for them and what medical coding can possibly do for them. So that will be tomorrow's episode. It will be pre-filmed, and I will not be in a live chat tomorrow. So just know that. But I hope that you'll watch it. I hope that you will share it. If you haven't had a chance to subscribe already, I hope that you do. And I hope you have a chance to check out my Facebook page because I'm starting to try to put more stuff on there. Okay, guys, it's just, you got to work with me. Okay, I got a lot going on. A lot of saucers in the air. So check out my Facebook page or whatever they're changing their name to. But right now it's Facebook. And it's Medical Coding with Blue. I have my own page there now. So check it out. KK says, thank you, Blue. Congratulations. Thank you again. Aaron says, it's definitely hard starting off remote. I just read and studied my guidelines at least 3 days a week. It's a day-by-day process. There you go. And you're welcome, BK. Thank you so much for joining in. And thank you for being a big part of the conversation. It really does help. So I'm going to wrap this one up. But thanks, guys, again. And I will see y'all on the next episode. Bye.